the blood health blueprint, what your blood does for you, carrying nutrients, dispersing oxygen, cleaning out your system, dealing with toxins, dealing with microbes, dealing with invaders, white blood cells, red blood cells, platelets. What do we do with this mixture of essential needed blood flow? How do we analyze this thing, help you a little bit with some of your blood work, some of the things you have going on? How can you get proactive to have healthier blood? It compromises everything. It compromises your energy, compromises your liver health and your toxicity, compromises your immune strength. So how do we strengthen those things? Out of the gates, the main thing that blood health impacts is energy. So if you deal with or need more of it, maybe it's your blood. That's the issue. Let's dive in and go. So the blood health blueprint, out of the gate, ferritin side of things, this is measuring how much iron's being stored. If this is low, we don't want to get it too high. We don't want ferritin up above 100 starts to cause problems. But if you're below that, it's kind of like vitamin D, right? You just want to get it in that sweet spot. So you've got enough of it. And realize, women, you have a ferritin detox happening every month. You lose iron every month for a long time, for decades. But then that stops. Men, you never get that blood loss, okay? And that means you're usually in scenario number 2, which I'm gonna talk about in a little bit, where ferritin's high. But for a lot of women premenopausal, your ferritin is low. Now, postmenopausal women, you start sliding back over into the high ferritin levels. See this balance? I did a video on why giving blood is actually very, very beneficial for you, let alone whoever you give it to. It's for this reason, because a lot of us never reflush our red blood cells. So I've given blood twice over the last 6 months. And it's a rhythm that I'm starting to get into. I'll probably settle into once or twice a year to allow my body to produce fresh red blood cells. I'm probably not giving that advice for someone that's low in ferritin and lacking red blood cells, right? However, how do you know? You start measuring ferritin levels. Have them check this one. If it's really high, it's a big stroke predictor, so you want to keep an eye on it. If it's low, you're not having any energy. Work with your doctor. I'm not your doctor. I'm not pretending to be. I'm not giving you medical advice. I'm just saying, hey, you're a little more informed of what ferritin actually is. Take a look at it, and all you want to know, in the normal range, out of the normal range, up above 100. If it's below 100, is it too low? We start getting in the single digits or the tens. You probably not getting enough pop, enough energy, enough hemoglobin red blood cell production that you would like to have because you're lacking that iron. Let's shift gears. Let's go to the other side. Increase ferritin. This can also be known as hemochromatosis. I want you to just more focus on this blood marker, right? Let's make this a little bit more straightforward, like vitamin D, because you can measure it very simply. It's a very basic test that most every doctor is going to do or know about. And you can look if it's really high, stroke risk increase, inflammation, liver problems. If it's really low, you're going to have energy issues, hemoglobin, red blood cells. 2 very valuable things to know. So that's why I want to focus on it. Now, if it does get high though, sort of the medical condition that you looked at is too much iron stored in the liver. Kind of feels like this. Also could be very fatigued because you're so bogged down. You can't detox the blood properly. Brain fog, mood swings, depression, anxiety, weight loss issues could go either way a little bit on that. Could be storing fat in the liver. Weakness, joint pain, especially in the fingers. ED, regular periods, or you just stopped or missed altogether. Could be just way too much of this building up in the body. And what it does is ferritin stored and iron is deposited in the liver itself. So ferritin is just storing it up because the body's getting hit with too much of the production. Typically, it's a complete breakdown in the oxidation and the amount of uncleanly processed foods and drink that we're putting in. That's what does a lot of it. So this is not producing enough iron and enough ferritin. So what do? Start adding foods in. You're going to remove vitamin C if you have hemochromatosis. If it's way too high, you back off of that. Calcium blocks iron absorption, so you might consider calcium-based foods like broccoli to be adding those in. And you don't have to be afraid of dairy in that scenario, unless you're sensitive to it. Now, red meat's going to add more iron to the system. Alcohol is going to force the liver to bog down more, which is going to store more iron. Fructose is going to do the same thing and produce fatty liver. Processed foods are going to do the same thing and overtoxify the liver. Iron-rich foods and just iron in general. If you're in this scenario, you're going to go the other direction and you want to avoid any iron-based supplement. Add iron-rich foods, processed foods, fructose, alcohol, vitamin C, limit red meat. This is what's got to go, but then add in some good healthy fats. Apples and apple cider vinegar can help break down buildups in the body. Broccoli, olive oil, fish, nuts, turmeric, another good one that helps to alter the absorption of iron. 20 to 80% reduction in helping the liver to clear this out. So it's a good supporter. Coffee is going to help with that absorption. Tea, and then lemon water between meals. This is a big one that I've been a huge component on for a long time. Adding it simply in your morning routine, help your liver out, allow your body to detox. Lemon water helps to break down calcification buildups, help to break down fatty liver buildups, kidney stones, very good for all the filters of the body. So here's the foods we're focusing on. Now, from a focus perspective, this is where you'll want to give blood. Now, questions around it as far as I can't give blood, would plasma count? You need to give true red blood, right? Just true red. The whole prep of it takes way longer than, it takes about 5 minutes to give 1/8 of your whole blood. And I avoid the cookies and the pretzels and the things right afterwards, right? I usually replenish with a lot of electrolytes when I do it, okay? Some of you can't give blood, okay? All right, we won't focus on that thing for whatever reason you have an issue with it. We just need to focus on liver cleansing then. All right. Now, we want to increase electrolytes and salts, the minerals to balance things out, especially if we're giving blood. The omegas and the turmeric both made the food list, so you can take the supplement form of these very easily. Fish, turmeric, good at supporting that liver, healthy fats, clears out toxins, excess iron in the liver. Magnesium, it's another good one as far as leveling out proper magnesium levels, helping to level out the excess ferritin in the body and the toxicity of the liver. And then we need to cleanse this thing. So the main focus here is we got to get from here back up to here. Cut off the foods that are creating excess iron, give blood, and then let's do a liver cleanse. So that food list that I just talked about, adding in the lemon water, maybe some coffee, that's what I'd like to do. And then you can add in the liver cleanse. So it's just how many people can we get from here to here, right? So losing weight along the way is huge as well. So if it's increased ferritin levels up above 100, 200, 300. So what do we focus on? We start focused on foods to add, but the big thing is what to remove. We got to get these foods out. You limit red meat. You don't have to get rid of it completely. You just cut it down a bit. Just to not overdo iron. That's all. You don't have to be a vegetarian. Giving blood 3 times in a 6-month period. So they only allow you to do it every 2 months, but that's a short-term fix to get from here to here. Okay, when you're following the eating plan. Like if you do the meal plan and then you're giving blood and you're doing the liver cleanse, you can make a big impact on this really fast. Now, testing wise, you'll want to monitor ferritin. Monitoring your liver enzymes as liver enzymes are high. This is a reason to dip into this. Measure your vitamin D level. Make sure we're in a normal range there. You don't need to overdo it. And then your platelets. Is there a lot of inflammation building up in the blood? Are those too high? I like to see them closer to 250. 450 is a normal high range. But if we're getting up in that, we're getting a lot of clumping happening in the blood. So these all start to tie together. Ferritin, liver enzymes, vitamin D, platelets. There we go. That's a lifestyle. You are the solution to it. You got to be the change. No one can take better care of you than you. You are the solution.